Dr. Darj, there is a subject called sleep apnea, and it's making big news lately. For instance, in New Jersey, a bus driver just wrapped a bus around a ball, killed a bunch of people, and they suspect sleep apnea. Not sure that he will have it, but here's what sleep apnea apparently does. It makes people in the afternoon go groggy. They just pass out, and that's dangerous. There seem to be more heavy car accidents than drunken driving, and that's something enormous. And the medical field knew about sleep apnea for long, but they haven't realized how many people have it. For instance, apparently, and you tell me whether I'm wrong there, apparently a huge amount of people who snore have sleep apnea. Personally, I don't know anybody who doesn't snore. In fact, that's how I got my wife on to wear a sleep apnea appliance, because she snored. I realized she sometimes stops breathing, and yes, in the afternoon she's the most active woman I know, and yet in the afternoon she's sometimes almost like, she says, I don't want to drive because I feel like I fall asleep. She doesn't have it anymore. Now, it's to what I just said. Is there some truth to that? That sleep apnea, which basically means you stop sleeping many times throughout the night, up to 100 times an hour or something like that, and thus don't get oxygen and obviously don't get sleep, and then no wonder you crash in the afternoon. Is that true?
Absolutely. Sleep apnea is a disorder whereby your airway is blocked for different reasons, and when you constantly stop breathing, the reflex has to kick in and make you breathe, so you never have a chance to get into that deep state of sleep, and that's why it's causing a lot of headways and chronic fatigue syndrome, and it's causing depression. A lot of us, I used to fall asleep watching movies all the time, and I thought that's just me, that's part of normal life, but I learned that's part of, that's the reason I have sleep apnea, and that's why I have these fatigue moments. Now, I don't fall asleep driving, but I do fall asleep when I'm watching TV. And there is a dental, we've been treating that for me. Now we've refined it and fine-tuned it, and basically it's a device that's similar to night guard, and it positions your lower jaw in such a way that opens up your airway. If you move your jaw, we can all do this, if you move your jaw back, you find that you're not breathing comfortably, and a lot of people with sleep apnea also grind, because when they grind, they flex those muscles and open up their airways to breathe better. So a lot of children with asthma or respiratory problems grind because of that. So sleep apnea is a modern malady, or has it been around forever? I don't know, but we can certainly help some of these patients who cannot wear or won't wear seatbelts. Pretty drastic.
Right. I mean, the way you describe it is actually more scary than I thought it is. I mean, it's true, because people who don't sleep or don't get enough sleep, they eventually will get depressed. They're tired, they're fatigued. And so I can see why you say that. And then I can also see that, you have some tension there. So now you might get the headaches, like you have explained how it might be with a DMJ problem, and, or do any teeth grinding and stuff like that. Absolutely incredible. And yes, the CPAP machine, which is basically a compressor pressing air into it with a big mask on it, seems to be the golden standard, of how to fix it, except people have a hard time wearing it. They just like, it's a noisy machine. My wife tried it, by the way, and it's noisy. So if mine was waking up, I say, honey, at least you snoring. I know you are here, but this, some funny machine making noise, that isn't so comfy. And anyway, people need to sleep on their back and all that stuff. So this device apparently is good. And also, is it true that when you have sleep apnea, it's a little bit like with, let's just say you need reading glasses or glasses, period. If I want to see very clearly what's going on the computer, I need to put reading glasses on it. I take them off, that second I don't see. And I heard that if you don't wear your sleep apnea device, whichever one you wear, next day you have the problem. It's not like with vitamins or with food. You can go for a while without it until it catches up on you. This is, you wear it, you sleep. You don't wear it, you don't sleep, and next day is that true?
Yes, absolutely. It is that positions your jaw in such a way to increase that air tunnel, if you will. You don't wear it, you don't breathe right. And sleep apnea is a lot more dangerous than depression and falling asleep while you're driving, although I think that's pretty dangerous by itself.
Because it causes it.
Right. I have known people who have died of sleep apnea. I have personally known people who have died of sleep apnea. Because if that reflex doesn't kick in on time, you stop breathing. You simply stop breathing.
Incredible. And so let's go back, for instance, to the CPAP machine without trying to knock it. And maybe if there's some huge, strong case, maybe they need CPAP machine. I've talked to doctors, they use CPAP machine and their appliance. But now if a person travels, like I do, like my wife does, it's pretty cumbersome to carry one of those machines around. They make them pretty small, but still, I mean, these days we don't like to carry a computer, never mind one of those big things. And obviously the mouth guard is very easy to carry around, correct?
It's much easier. And it's again a matter of lifestyle. CPAP machine it's pretty scary for a spouse. If my husband was wearing a CPAP machine, I would have a problem with it in the middle of the night. Plus, most of us in our early years or even middle years, in modern day lifestyles won't allow for good night's sleeps. You have things in your mind, and having a device strapped around your head and face, it definitely is cumbersome, and it's just counterproductive. Right.
Yeah, right. That's why, as I said, and my wife is disciplined like heck. I mean, if there is something, it doesn't matter how inconvenient it is, more or less, she will do it. She's extreme. I mean, if I would be as disciplined as her, that would be kind of wonderful. But the point is, even she said, this isn't working, and this other device does. Now, looks to me like that's something people should check out if they think that they need that coffee in the afternoon, that Red Bull or that Coca-Cola pick-me-up drink, and if they're at the same token snore, which they know if they have a spouse with them, they should try that, and then probably the spouse.
They should look into it. There are devices, anywhere from a simple device that positions the lower jaw to a lot more intricate testing and devices. There are solutions, and sometimes there are simple solutions.
And imagine the happiness of the spouse if he or she doesn't snore anymore. I said, imagine the happiness of the spouse when he or she not only now is breathing and doesn't get irritated next day because he's tired and exhausted, but he didn't snore the whole night.
Right. It's a matter of lifestyle. We are trying to enhance people's lifestyles.
Yeah. And, definitely, I mean, being awake, being alert, that's what life is all about, right? I mean, there is nothing else than having fun. Thank you very much.
Yes.